Okay, here's why I left NHS dentistry part 3, targets and clawbacks. Here's something you might not know about NHS dentistry. Dentists work under strict targets. Let me tell you how it works. So NHS dentists are given specific targets to meet at the beginning of the financial year. These targets are called units of dental activity, or UDAs. But here's the issue. If dentists or practices don't hit these targets, they basically face penalties. That might mean a fine which needs to be paid, which is called a clawback, or losing funding and having their practice's budget reduced for the next year. But wait, what happens if I exceed this target? You still get penalised for that as well. The NHS won't pay for any additional work done beyond the limit. So in some cases, when it comes to February, March, dentists are told to take unpaid leave just to avoid overachieving. It's weird because I thought we were in a crisis where there's no NHS dentists. Look, I made this video because I really want people to understand how much of a difficult position it puts dentists in when it comes to patient care, because if they're behind on UDAs, they might feel pressured to rush through appointments and reduce the time they spend with their patients, which can of course lead to lower quality of care and poor patient satisfaction, which we all know about NHS dentistry. And if they've exceeded their target, dentists might have to delay checkups and treatments to the new financial year, so in April, which is crazy because this can lead to someone's dental health getting worse in that time period, whether it's weeks or months. I know this might be a bit hard for some people to believe, but dentists actually want to provide the best care for their patients. And when there's targets involved in a healthcare situation, how can we realistically do that? Follow for part 4 and I'll go into more details on units of dental activity.